Okay, so for our next assessment, we're going to look at a ventral glide of the hip or an anterior glide. So my patient's now in prone, and I'm going to test the right side, but I'm going to have her slide over to the left side of her table. So scooch over toward me, please. All right. So as far as stabilizing the pelvis here, we're going to use a belt and a wedge again. The wedge is placed under the ASIS now, so I'm going to palpate and then roll her back down, make sure that that's taking up enough slack. If I needed to, I could use a larger wedge. This one's good enough for her. And then to keep the pelvis from rocking back and forth, I can add a stabilizing belt over the pelvis as well. And now I'm palpating for the PSIS and making sure the belt holds her pelvis down there, but doesn't get in the way of my mobilization hand. Okay, so now in prone, we position her into resting position. Again, abduction to about 30, slight flexion. As you can see, she gets some from the wedge and slight external rotation. Now I'm going to palpate for the greater troch, and I'm going to scoop up and onto the posterior aspect of the proximal femur. And my test is a anterior and slightly lateral force, mostly anterior. Take up slack and assess. Okay. Again, this same position can become my treatment position if I like, and I may even position her into hip extension by using a rolled towel or bolster. So here you can see that I've created a little bolster to keep her into hip extension here, and now I can treat to increase mobility here. I'm using more force, and this is a mobilization. Same setup and stabilization of the pelvis. Okay. Because we're assessing the hip in the context of someone that has lower back pain for this class, oftentimes a prone position can be an irritable position for this patient. I think someone with spinal stenosis. So to offset any pain that they might have in prone, we can use a pillow. So the pillow is going to bring her lumbar spine into relative flexion from this relatively extended position. So can you, let me switch this pillow into your stomach, please, Megan. Thank you. If this wasn't enough, I then have her lie back down, make sure it's not under hips. Come back up for a second, please. Just switch it up just a little bit. And then I'll ask her how she feels with that, okay? If it's not enough, I could double the pillow up, or I could put something else underneath there. And then once I've positioned her here, I can then set her up the same way for the ventral glide. So wedge under her ASIS, recheck that it's stable here. Belt placed posteriorly over the PSISs, which I recheck for. And then I can bring her back into either the test position here or a treatment position by using a bolster to bring her into hip extension. And that should prevent back pain from occurring because of excessive extension.